Joining us on Indiana in the Morning here on WCCS AM 1160 and 101.1 FM is an infection control specialist and a board-certified diplomat of the American Board of Ophthalmology and a fellow of the American College of Surgeons, Dr. Jesse Pelletier. Dr. Pelletier, thank you very much for joining us this morning here on Indiana in the Morning.
Thank you very much for having me on. Pleasure.
Our pleasure indeed. Let's talk about the situation right now. We have a lot of people who are saying that they are going to deliver on a coronavirus vaccine. You've got a lot of different companies and a lot of politicians making promises on the issue of getting a coronavirus vaccine out there. But it's not just going to take just a vaccine to kind of beat this, right?
That's right. I think we all want there to be a magic bullet, something that just breaks the back of viral transmission. And vaccines are clearly our best shot. But the reality is this strategy can prove difficult. We know that Americans are hesitant to be vaccinated. Polls have shown that up to half of Americans would decline a vaccine. Just look at the 2019 measles outbreak. And we know it's not vaccines that save lives. It's vaccinations that save lives. Mm-hmm. Also, as you alluded to, many of these vaccines represent new platforms. We have mRNA vaccines or the delivery of a vaccine in an adenoviral vector. Some of these platforms have never been FDA approved before. So there could be some problems, some hiccups along the way. Moreover, because of the tapestry of different vaccines, some may better protect certain cohorts as opposed to others.
So
finally,
go ahead.
Sorry, go ahead.
So one group.
Finally, the supply chain as well, which can be difficult. In the middle of a pandemic, buying caps, containers, and many of these vaccines need to be, transported with sub-zero temperatures. So what I really think is going to happen is we'll have a layered response, meaning that a vaccine will form the bedrock of our protection, but we certainly need continued public health measures, and we need the development of therapeutics, and we need a broader range of therapeutics.
Going back to one of the points that you had mentioned when it came to vaccines and affecting certain cohorts, so maybe a universal vaccine that is put out and published may not help everybody in the population that needs to receive it, is
Correct.
What it sounds like.
If you look back on some of our vaccines that have been the greatest successes, I think something like the polio vaccine, which almost nearly eradicated the disease. But then you look at something like TB, where you have the BCG vaccine, which I think is effective about 50% of the time. So you still need, with TB especially, of course, you still need other strategies. Now, we have so many candidates, so many different platforms. We just don't know where we're going to end up on the spectrum with what's available.
What are some of the other strategies? You mentioned to continue good health practices. I would assume that for at least coronavirus's case, that would include continuing to wear masks and social distancing, making sure that you wash your hands frequently, things like that, right?
Yeah, so again, we have to always double down on our infection control strategies and our public health strategies as well. But I think there's particular promise in the area of exposure or pre-exposure prophylaxis, post-exposure prophylaxis, using complementary alternative therapeutics to decrease transmission in conjunction with masks. Something like there's something out there called Halodine, which is a povidone iodine-based antiseptic formula that's used in the nose and the mouth. Mm-hmm. I think this is phenomenal because you're not only treating where the virus initially infects, it's where it replicates. It's from where it spreads in the forms of droplets and aerosols. So by killing virus in these areas and early on in disease, we can thwart transmission, we can protect otherwise healthy tissues from new infections, and we may be able to prevent progression of disease through the oral lung axis with virus traveling down to the lung. So and that and among some other candidates that are out there, I think will really be helpful in the future. We don't have anything that can help protect patients that are in the outpatient setting or patients who are just routinely think they might have been exposed and want to take something to potentially ward off infection. So I think that's a great area of promise.
Mm-hmm. Okay, that does sound good. Is there something, a project in the works maybe with vaccines or the medicine world that is going to give it a best shot to achieve that goal that you just mentioned of getting it right at that particular moment when it is in the early infection stage?
Yeah. I think that's the That's how we change the course of the pandemic. Really, is to treat early on. And again, I think it's halodine. Halodine is a povidone iodine based antiseptic, which is made for this. There was just a publication yesterday in JAMA Otolaryngology Head and Neck Surgery indicating that these formulations kill the virus in as little as 15 seconds in the nasal formulation, even faster than ethanol.
Wow.
So this is really, as an adjunct to PPE, could be spectacular. So we're very excited about this.
That's quick. That is super quick if it can get the job done in 15 seconds like that.
Yeah.
All right.
So, yep.
Go ahead.
And a lot of this is about learning new behaviors. Like we should also think about, similar to how we might wash our hands before we place our gloves, we should think about cleansing our nose and mouth prior to placing masks. I think a lot of infection control in the setting of a pandemic, in the setting of a country that has never experienced something like a SARS outbreak, all of these things and behaviors are new to us. So it's going to take a while for adoption.
Yeah, well, another good idea that I just remembered is the washing of reusable masks if you use those instead of the disposable kinds.
Of course. Or even the treatment of masks with some sort of anti-infective coating could be very helpful as well. So yes, all good ideas.
We're talking with Dr. Jesse Pelletier, who is an infection control specialist, and we're talking about some of the techniques that might be needed to beat COVID-19 other than just a vaccine. And as we mentioned, everybody does kind of want a silver bullet, but it may not be as easy as it sounds. Doctor, how far away are we, would you say, from maybe getting something out there, either a vaccine or a multi-layered treatment that would be effective?
So with respect to vaccines, I think that there are a few candidates in phase 3 testing right now. Moderna just reported that they had enrolled almost 30,000 patients in their phase 3. So I believe that we're going to be looking at an emergency use authorization probably from one of these big companies in the fall. But that's, again, just the beginning because of the supply chain and logistics. So those vaccines are probably going to be placed first in those who need it the most, those with comorbidities, those who are elderly or very ill, and then probably frontline healthcare workers. And then we're going to have to come online with a greater volume of vaccine production, and we're probably looking at most Americans being able to receive some sort of vaccine by the middle of next year would be my best guess.
So mid next year. So probably about summertime next year, we're probably going to be able to see this. And this, I don't think it sounds like it would be something that once you get it, this does not give you a license to go back to the way you were living your life.
There's just too much variability with the vaccine. We just don't know how much protection it's going to afford. We know that it can engender antibody responses, but we don't know how much that's going to translate into protection, and we're going to need some more data on that. So it's going to take a little while to fully understand. So I highly doubt that one vaccine will cover everybody.
All right. Dr. Pelletier, thank you very much for joining us on Indiana in the Morning to discuss this, and we wish you all the best. Thanks again, and stay safe.